I'm Chris Kruger. This is my six-pack life. I want it to be your six-pack life too. Today I'm responding to another subscriber comment. Kinta02 wrote in and said, Chris, I know I've asked you about herniated discs before, but 30 minutes ago I was doing heavy rows in the gym. I felt a tweak in my back, and now it hurts to do anything. It hurts to sit, it hurts to stand, and I'm struggling with it. And Kinta02 wants to know for me, because in 2009 I hurt my back. You guys remember I did the 70 days video, but I herniated L4, L5 right here in my lumbar spine. Terrible pain, couldn't move, got depressed, ate a ton of crap, gained like 50 pounds of blubbery, soft, gross fat. And since then, through my rehabilitation and even my training now, everything is all about a stable core. And that doesn't mean doing a ton of crunches. I've talked about this before, and I'll say it again and again. When you do crunches, you're just bringing your rib cage to your hips, you're curling up in a ball. And actually for a lot of people, it adds to greater muscle imbalance and actually can lead to a weaker core because you're not balancing it out with the muscles on the back side. They're helping you stand up, be tall, and have nice erect posture. That's what makes us unique as humans, is we stand up tall. We're Homo erectus. Whereas other animals have their hips and their shoulder blades and their spine is a suspension bridge. It just gets to hang out all loosey-goosey. As humans, we need muscles, the multifidi and the spinal erectors, to help us stand up tall and to stabilize each vertebrae as it stacks on top of each other, because our shoulders are stacked over our hips and not in line with them. So I want to talk about having a strong back today, and Kinta02 wanted to know what are the moves and the things that I do to keep a strong back and to prevent back injuries. Because let me tell you, it's the fulcrum in your whole kinetic chain. So the lower back is often exposed to injury. People have weak lower backs. And then there's other things that work down here under the muscles is your posterior chain. So your hamstrings, your glutes, and the muscles of your low back form a chain. And just like a chain, they connect and each link pulls on the next one. Now I have some clients that are writer-directors. So they're either sitting at the desk on the computer writing a brilliant script that you can watch in the movie theater or on TV, or they're on set directing. So they're sitting in that director's chair, hunched in front of the monitor. And it has to do with lifestyle and everything, but if you're in front of a desk or in front of a monitor, people start to get really tight hamstrings. And that chain of the hamstrings pulls on your glutes and pulls on your low back. So whether or not you've herniated a disc, you can still have tremendous low back pain just from tight muscles and spasming. Let's talk about a few things we can do in terms of the way we move, how we hold ourselves, and then also stretching and strengthening exercises we can do to protect our low back and prevent those injuries and reduce or eliminate that pain. First thing I want to talk about is form and motor pattern, the way you move. Okay? Extension, smiley face. If you keep your back neutral or extended, you're fine. Where we get into trouble with herniated discs and back pain is when we're sitting slouched in flexion for a long time, or even bending over and doing something silly as picking up a paper clip. You can actually bend down, pick up a paper clip, and if you flex your spine, you put your spine in flexion, you can herniate a disc picking up something as light as a paper clip. So we always want to keep, even if we're outside the gym, is keep our spines in neutral, have great posture, and follow a few simple cues, even if you're just walking down the street, is core tight, shoulders back, chest up, back flat. Just having great posture whether you're sitting or standing. If I'm sitting at the computer, chest up, spine in neutral or maybe slightly extended, shoulders back, head up tall. We just want to always, everywhere in life, avoid the flexion, the slumped shoulders, the forward head posture. Because now this is just pulling on your back, it's making it tight. And again, pick up a paper clip, herniated disc. It's totally possible. My wife's a physical therapist. She's seen people with herniated discs from picking up stuff as small and light as a paper clip. So just keep those cues in mind all through your day. I know I coach one guy to just walk with exaggerated great posture. And if you're always thinking, exaggerated great posture, big chest, shoulders back, stand up tall, head up high, then when you forget about it, you're going to maybe go to good posture or normal posture. But you always want to avoid the forward slumping. Okay? Now, core and back exercises. Let's talk about a few moves that we can use to strengthen our multifidi, our spinal erectors, and then eventually we also want to lengthen our posterior chain, especially the hamstrings, so that it's not pulling so tight on the glutes and the muscles of your low back. So I just did a video on real core training, not just coming in and doing your abs routine and making yourself slump forward more and have worse posture, but actually strengthening these muscles that are underneath your thoracolumbar fascia. So you have this fascia right here, and underneath there are your multifidi and your spinal erectors. And on my clients, I'll have them do a Superman, and you can start to see the spinal erectors create a huge ridge of muscle under that fascia. And that's the muscle that supports and stabilizes your spine. But real quick, I want to demonstrate a couple Swiss ball exercises. This is a regular green Swiss ball, 65 centimeters. It's a little soft right now. I'll put a link in the video information below where you can get a green Swiss ball on Amazon, super cheap. But here's two great moves that I do particularly for my low back as someone with a history of lumbar pain and herniated discs. So number one is an alternating Superman. So I'm going to place the ball down here under my hips, hands out wide, kind of a push-up position. I'm going to raise left hand, right foot, balance, and you can see there if you come in close with the camera, is my spinal erectors fire up and create a ridge around on each side of my spine. So I just want to come right out, elevate the heel, elevate the palm, and switch it right over. Now I notice some of my clients struggle with this because they'll have their feet too wide or their hands too narrow. So wide hands, push-up position, feet back about 5-6 inches apart, up high, switch. Okay, and then the next move is just a reverse hyper on the Swiss ball. So I'm just going to drive my heel up to the sky, just like that Superman move, but now I'm going to focus in and do several reps on the one side. Get in there really tight. I'm activating that glute and my spinal erectors, stabilizing. So those are two great Swiss ball moves. If you don't have a Swiss ball, get one. You can do a ton of other stuff with it. I should do a video that's just Swiss ball moves because it's nice, it keeps you off the floor, and you can do a ton of different core training with it. So real quick guys, I want to talk about some limiting factors when we're training and in terms of the health of our low back. So number one is hamstring length. I see this all the time with my clients, but there's a move I do, and I'll make a video just on this. It's an active, passive hamstring stretching technique that just increases your range of motion immediately. So look for that video to come out. It's super helpful for my clients. It'll be super helpful for you. Loosens up those hamstrings, gives you some more tissue extensibility, and just takes the stress off the rest of your posterior chain, and you don't get that same pulling on your low back. Now, Kinta02 wrote in, he was doing some heavy rows and he hurt his back. And I don't know if he was using any of these things, but I don't recommend them. Now, the heavy-duty power lifters and weightlifters will be like, you're crazy, but let me explain myself. I don't use straps, wrist straps, knee wraps, or weight belts, ever. And my thought there is for straps, what is the point of having the strength to pick up a weight that you can't hold on to, that you actually have to strap to your hand? You know, you're able to load yourself beyond what you can handle, and that's just exposing yourself to greater risk. Now, the power lifters and the weightlifters that use straps probably have a long history of injury. Okay, and they come back from it and they keep training, and that's their thing. But if your thing isn't powerlifting, there's no reason that you need to get so strong that you need to pick up a weight that you can't possibly hold in your hands. Same thing with wraps. You're increasing the hydrostatic pressure in your knee to be able to squat a weight that would explode your knee otherwise. Seems silly, right? I actually have a story about that. Several years ago, I was working on the set of a Ben Stiller movie, doing some kind of auxiliary stunts, and I was there with another guy who had been a huge power lifter, like straight out of Germany. This guy was enormous. And he'd squatted with heavy, heavy reps his whole life, you know, like 600, 700 pound squatter this guy was. And he said one day he was out snow skiing, alpine skiing, downhill skiing, lost an edge a little bit, and you know how, you know, like you get it caught off balance and your whole body just kind of tenses up? He'd made himself so strong that just that little tense up, his quadricep muscle ripped the tendon out and rolled up his thigh. And then he went to the doctor, and the doctor's like, yeah, dude, you're way too strong for your own tendons. And when you do things like lift with straps or wraps, you can get that strong if you keep doing it and doing it and doing it. So I'm only talking to a very small percentage of the population here that are really into using straps. And the same thing with weight belts. If your core can't support the amount of weight that you're trying to move, then choose less weight and build up slower. And the final thing is, guys, always be careful. And one of the easiest times to hurt your back is when you're racking and unracking the weights. You're not paying attention, you're thinking about the set, you're thinking about something else, you're thinking about the girl you saw across the gym, or the score you just saw on SportsCenter on the TV, and you're just going through the motions. Always, whenever you're going to load your spine in any manner, even if it's to do bicep curls, when you pick the weight out of the rack, you're loading your spine. So always be careful, be mindful, and protect your low back. Before you pick that weight out of the rack, chest up, shoulders back, core tight, lift it out, flex, tense, ready to go. So guys, make sure you check out that core training video I did. Start building up your multifidi, your spinal erectors, and build real functional core strength. And you know, we're going to get more in depth in future videos, how to lengthen your hamstrings, different ways to engage your multifidi and make sure they're working, you know, the pelvic tilt you use, posterior, anterior, neutral, all this different stuff that I want to pass on to you guys. What do you want to know about? Please subscribe to the channel. Please like this video, share this video, and leave a comment. What do you want to know? What should I talk about? Is it diet? Is it training? Is it nutrition? Are there other questions that you guys have? Please leave a comment right now and go check out one of those other videos. I'm Chris Kruger. This is my six-pack life. I want it to be your six-pack life too. Make it happen.